¿Cuándo va a ser en español?
So, en español, cuando acabemos la reunión, la vamos a poner en YouTube y ahí puedes, si haces el closed caption, lo puedes traducir al español.
Disculpe, ¿qué dijo?
Sí, cuando lo pongamos en YouTube, va a haber una opción para que traduzcan en español. So, no lo vamos a hacer en vivo en español, sino vas a tener que verlo pregrabado en YouTube.
Oh, gracias.
De nada, Rocío, gracias a ti.
Hey, folks, we're going to give it a few just to admit some additional people in, but we should get started shortly.
Hi, everybody, and welcome for coming. We're just going to wait a few more minutes as people are coming in. So thank you guys that are coming in and joining us.
Thank you.
So we'll give it maybe one more minute. Is that okay? And then we'll get started. So 3:02. So thank you, everybody, for being patient. Really appreciate it. Welcome, everybody. We're just waiting one more minute to get started as we're getting more people into the chat. So thank you so much for joining us and being patient as we get started. All right, I think we're going to get started just to be respectful of everybody's time. So it's 3:02. We're just going to get started. Thank you, everybody, for joining us today. We have some special guests with us. We have Adriana Segura with Chicago Public Schools, and we also have Dr. So with the City of Chicago Department of Public Health. My name is Berenice Pan. I'm also with CPS, so I'm a FACE manager working with family and community engagement. But I'm also a parent. My son is in 6th grade, so like many of you, I'm also tasked with making the decision to opt in or out of sending Henry back to school. So I know many of you guys have a lot of questions, have concerns. So today we're going to touch on a little bit of those things. Some of you guys who pre-registered put some really great questions that we're going to ask Dr. So in a little bit. But first, I want to get started with Adrian and having him talk to us a little bit about what reopening is going to look like for January and February for the rest of the kiddos.
Thank you, Bede, for helping organize this really important conversation. Our hope is, even for those who aren't able to join us live in person, that you have some chance to watch the recording once we share it out afterwards. So thank you in advance. From my seat, I think the biggest thing I want folks to walk away with, over the summer, we did a lot of engagement around our reopening model, and we presented the hybrid in front of various parent focus groups. We held various town hall sessions. I know FACE managers did a lot of work in networks to have smaller scale meetings, very local meetings. I know principals have also done a lot of outreach and engagement to make sure that families have access to the information that they need to make what I believe to be a very personal decision that meets their household's needs. One of some of the biggest things we heard loud and clear from families in the summer was they wanted more time, more time, not only time to make a decision, but more time between that decision being made so that they can understand what are the health dynamics, how are things playing out, what is in-person going to look like, what does it mean for my kids specifically, what am I opting into, what am I opting out of? And so parents just wanted more time. And what we've done this time around, I think, gets to the heart of that. While decisions are due on Monday, December 7th, there's about almost a 2-month window from the moment parents make their decision to the moment students are expected to be back in person. And so I think that's something that's really worth emphasizing and reinforcing that decision that we made is because parents in the summer and in the early fall really pushed our thinking, and we heard, that's us saying we heard you. The second thing I want to raise is I think that the reopening guide that we've put in front of parents this time around, one, it's not 30 pages long, it's 12 pages. And I think it's really clear. I think, one of the things that we noticed when we tried to reopen in hybrid, one of the things that we noticed when we tried to reopen earlier this year was, parents had a lot of questions. Some of the questions were similar, but there was clearly something that wasn't necessarily sticking. And so I think the way that this reopening guide is broken down it's very clear. Parents who are choosing to remain in person, parents who are choosing to remain remote know exactly what to expect with choosing remote as an option. Parents who are opting into in-person know exactly what to expect around what opting into in-person looks like. And the guide, I think, has a very easy to follow chart that's clear. And the third thing I'll say, I think I've been in a couple of these meetings this week with various stakeholders, community partners, advocacy groups, and parents. I think one of the things that I want to highlight for parents that are on the fence about making this decision right now, like, I'm not here to convince you one way or another. Like I said, I know there's a very personal decision. That being said, you can choose to opt out of in-person learning at any time. So if you choose to opt in today, and it's the week before in-person begins, and you're not feeling comfortable with sending your child back, you can still choose to opt out at that point in time. And so, one of the things I think I want to make sure that we let folks that are listening both live and the recorded session know is that at any moment, you can choose to opt out. If a lot of our families that I've spoken with, the grandparents are starting to move in with them, for a variety of reasons. And so maybe your grandparent isn't living with you today, but maybe, come end of January, that situation changes and you need to then adjust your plan. You have the flexibility to do that. And so, what I'll do on my end is I'll share the reopening links in the chat for folks to have access to. But I'm going to kick it back over to Bere to continue the conversation.
Thank you, Adrian. And I think that's very helpful for parents to know that if they choose to opt in today and then they change their mind, they can opt out. So that's great. Thank you so much for clarifying that. So Dr. So we're going to go with you and pick your brain a little bit and use your expertise to answer some of the questions that parents had. So for the parents that are with us right now, we're going to go through some of the questions first that we got online from parents. And then after that, if we have time, we'll answer some of the questions. So you could put some of those in the chat as well. So to get us started, one of the things that parents are concerned is the spike in numbers with COVID, right? So they want to know, even though the numbers are going, why reopen now? It's safe for their kids to go back into the classroom.
Yeah, I think one thing to keep in mind is there are schools outside of the CPS system that have been open all this time. And we have been really reassured and pleased with what's going on in these other schools. Meaning that we're not seeing a lot of transmission within the schools. So what does that mean? So, given the amount of community spread we have of COVID in Chicago, and this has been the case from the beginning of the pandemic in the spring, we've had a lot of spread. So yes, there are people, students or staff members who may have COVID and may have been at the school, but we're then not seeing that another person at that school is getting infected by that person. And that's because of all of the very strict mitigation or preventive measures that the schools have in place. So like making sure everyone's wearing a mask when they're at school, making sure people are staying socially distant, so keeping the desks apart, having good hand hygiene, making sure that people are staying with their pods or their cohorts so that if there is someone in that pod who's positive, then there's a lower chance that a bunch of people are going to get infected because you're only sticking to your one pod. So, and then, making sure that whenever there is a positive person, making sure that we quickly identify who needs to go home and quarantine. Again, we've been really, really reassured and pleased with how well the schools who have offered some in-person learning have done. So, in terms of why is it safe now, I think the other thing to keep in mind is, so we are in a second surge. We cannot deny that, and it's very serious. We've seen some reassuring signs that things are starting to stabilize and maybe we're starting to bend that curve. Keep in mind that we have another month or so before the first group of students may be coming back in person, and then even a couple of more months after that. So a lot of things are going to change during those months, the few weeks coming ahead. The one major thing too is that the vaccine. We know that our first Chicagoans are going to get vaccinated probably before the end of this year. So, anytime there are more cases in the community, there's a bigger chance that someone at school, that someone might actually come to school, whether that is a student or staff member or teacher who has COVID-19. But because of all of the different measures that schools have put into place and that CPS will be putting in place when students are back in person, that's really prevented. So these people who are coming with COVID, they're by and large getting infected outside. So a family member, or maybe they had a gathering or something like that. Mm-hmm. But the important thing that we've been so pleased to see is that even though a student or teacher may have been at school with COVID, then other people aren't getting infected by that person. So really, those preventive measures do work. And it also matters what families are doing outside of school. So my kids are younger, so they're not in CPS yet, but they're in daycare. And my family has made a decision that we're not going to gather with other people. We're going to stick to ourselves because our kids are going to daycare. We want to have daycare as an option. We want our kids to keep going. And we don't want to inadvertently introduce COVID into our daycare. So we've made that personal decision to kind of really, really restrict ourselves, knowing that our kids are attending daycare. So, we really are all in this together. And I think this pandemic has made us realize how connected we are to each other.
Absolutely. Yeah. And thank you so much for that, Dr. So, and talking about health, one of the bigger questions that I get from a lot of our parents, right, with students who have asthma or whose immune system is weak, right? Like they're afraid to send those students to school. So can you talk a little bit about that?
Yeah, no, that's a great question. And as was mentioned before, this decision is a very personal one, and it's one that should be made for your child and your family. So I'm a pediatrician. I still practice primary care pediatrics, and I'm also an internist. So I see whole families. And so really this is you have to kind of make the decision that's right for your family and for your child. I would recommend for those students and staff members who have underlying health conditions, that this is a good time to have that conversation with your primary healthcare provider. And just to ask, hey, what do you think about my kid going back to school? If your kid's asthma is well controlled, it's probably going to be fine. But your healthcare provider would know the best about your child and can help you make that decision of whether to opt into that in-person learning. Again, with all of the good preventive measures that have been put into place and that CPS is planning to have in place, it's going to be a safe environment. But families are right. You need to take into account the individual situation of your child and your family. So I would encourage folks to talk to their healthcare providers. I would want my patients and my families to talk to me to have that discussion. I can guide them like, okay, well, his asthma is really not well controlled right now. Maybe you need a little bit more time. Maybe this year is not the right time. Versus a kid whose asthma is well controlled, hey, go out, go do that in-person learning, get the advantages of doing that. You'll have your inhaler at school, we'll fill out the paperwork, but so you need it, and your asthma action plan, things like that. So again, this is kind of a team effort. So talk to your healthcare provider to get the best advice there.
Great. No, thank you. And I think that's great advice for all the parents to go out there and get their primary care provider, right, to give them some guidelines. And talking about that too, I know CPS put out some surveys. There was the state came in and looked at our buildings, and then they were talking about HEPA air purifiers. How well do those work for this kind of environment?
Yeah, that's a really good question. There's been a lot of attention brought onto ventilation and all of that, which is so important, especially as we go into these colder winter months. I just want to back up a little bit and just remind us all about how COVID is transmitted, because we know a lot more now than we did back in March. So we know, based on the data and how cases have risen and fallen and things like that, we really do know that the primary way that COVID-19 is transmitted from one person to another is through those respiratory droplets. So it's the droplets that come out of our noses and our mouths when we cough, when we sneeze, when we talk. And these droplets, by and large, can't travel past 6 feet. They just fall to the ground because they're too heavy. That's why wearing a face covering is really important too, because actually those masks capture those droplets so they don't get out and get onto someone else. And so the most important way to prevent anyone from getting COVID-19 is to wear the face covering, to keep that physical distancing of 6 feet or more, because again, the droplets really can't travel that far, to make sure you're washing your hands really well, not because COVID can sink through your skin and infect you. It's because you could touch something that may have had someone's droplets on it, and then if you rub your eyes or you rub your nose or you touch your mouth, then the droplets and the virus will have gotten in that way. And so those are the most important things in terms of how to prevent COVID transmission or getting COVID, which is why people keep talking about wear your mask, watch your distance, wash your hands. Now, there's been some questions about, so what about smaller droplets or smaller particles, or these airborne particles? So there have been more studies, and we know that in some instances, the virus may survive and may travel in these smaller air particles that can go a little bit further or hang around in the air after someone with COVID has left a room. But in those situations, there are a couple of things that are really important. One is that in the situations where there was concern that maybe those smaller particles actually transmitted COVID, it was in very specific situations where people were shouting or singing or exercising. So really forcefully expelling out those droplets and particles from their mouths and noses. And also the second thing was that the ventilation was really, really poor, like no ventilation. And so this is where the ventilation systems, HEPA filters come into place. You probably are all aware CPS did a lot of work to make sure that ventilation is optimized in the building. So ventilation, you want to make sure air is moving so that any particles, whether they're big droplets or small droplets, can leave the room. So that makes sense. And then the HEPA filters, they capture the really small particles, and they remove it from the air that's in a room. And so you kind of need a combination of things. HEPA filters by themselves aren't going to help because you need good ventilation to move them towards the filters, and you want air to be moving. And if it doesn't matter if you have a HEPA filter, if you are getting up close to people, not physically distancing, not wearing your mask, the HEPA filter is not going to get rid of COVID. You can still get COVID. So it's an additional measure. It's a good thing to have good ventilation and good filtration. But the most important things are the 3 W's: wear your mask, watch your distance, wash your hands, and having good ventilation is an extra bonus, and it's going to definitely help reduce people's risk of getting COVID in a building.
Okay, thank you. Thank you for that clarification and for keeping reminding us to wear our masks, wash our hands, and keep our distance.
It works. And we have, again, with the masks too, I mean, we're in a second wave, but it's, we are better prepared because we know a lot more, and we know masks work. If everyone is wearing a mask, and it doesn't have to be a medical grade mask, it can be a cloth mask, we know that your risk of getting COVID-19, of that being transmitted, goes down like 70%, which is incredible. Mm-hmm. So, and people can get cute ones too. It can be part of the wardrobe now. So, yeah.
Absolutely. No, thank you for that. In talking about that and being in a classroom, right? One of the questions that we got from parents was, what's the difference, right? When they go out to a restaurant and they're eating and having, that family time compared to being in a classroom, right? So now, they're not allowed to eat indoors. They have to eat outdoors, but now we're sending kids into a classroom that is closed off. So can you talk a little bit about the difference?
Yeah, so, one thing with restaurants is masks are removed. So when your masks are removed, it's going to be easier for people's droplets to get out and get onto someone else. But the other big difference is all of the protocols that schools have in place and that CPS is going to have in place. The ones that I mentioned, where people are going to be sticking to their little pods. People are going to be physically distanced away from each other. So at restaurants, people are still at a table right next to each other. And tables, I think, only have to be like 6 feet apart from each other. So it's like groups of people closer to you. But in a classroom, the students are going to be spread apart. Everyone's going to have their masks on. And there's going to be lots of good hand washing. There's going to be a little bit less of people just roaming around, kind of like you would at a restaurant, even if it's outdoors. So it's very, very regimented, a strict protocol. So school's going to look different than it has in the past. But it's all these safety measures. So there's more control in schools than we have in other settings, whether it's a restaurant or a gym or a store. There's a lot of control that the school has in terms of the movement of the students and where they're sitting. And it's part of the day-to-day education too that's going to happen. And I mean, for the adults too, right? I have to remind myself to step away from my colleagues when I talk to them. But really it's that the fact that there is more control in a school setting, and there are very strict preventive measures that will be in place. And actually that we know work from what we've observed in schools around the country and schools here in Chicago, and actually globally as well.
Sure. Can you talk a little bit more about that? I know you talked earlier about like the pod system, right? We're having the students in different pods and being a little bit, having more control, and you've seen in other schools that are not CPS and around the country. Does it really work to have the students in pods?
It really does. Because what happens is, again, if there is someone who has COVID in that pod, that entire pod goes home. This prevents more people being exposed to that one person. So by having a smaller pod, you are also, because if you think about it, if I'm in a pod with someone else, I'm not only being exposed to that other kid, I'm being exposed to whoever else the kid had encounters with outside of school. So if you are shrinking the number of people you are interacting with, everything is smaller. Your risk of exposure to COVID or someone who's been exposed to COVID is smaller. So your risk goes down of getting COVID, because I don't know if you saw those statistics, like if you're in a room with 10 other people, then X number of people might have COVID if you're in a room with 50. So the more people there are, the greater the chance that you're going to encounter someone with COVID. But then also, if someone does have COVID, like I've mentioned, fewer people are exposed. And so even if and again, we really haven't seen much of this at all, like just a handful of times when it's happened in other schools. If there was spread, it's going to be limited to just a few number of students, not the entire school. So it really does work. But I think it's also that concept of your bubble and remembering that your bubble, and if people are like going outside the bubble, you're being exposed to like everyone else too.
Yeah, no, I think that's a good point that you're making, right? That we're controlling the kids at the school, but also, like you said, right? Like you're not going out with your kids in order not to expose the kids that are in your kids' pod at daycare. So that's definitely a good point to make for parents to have in mind. And talking about that, I know one of the protocols the CPS was putting is about taking the temperature when kids are coming in, right? So is that really a good indicator for COVID? That's one of the questions that the parents had, if they're going to take that temperature.
Yeah. So fever is one symptom of COVID-19. It's not the only symptom. But the nice thing about temperatures is it's some of the other symptoms you can't, put a thermometer or figure out if your child may have a stuffy nose. They actually have to tell you. So it's one symptom, but it's not the only symptom. So it is helpful to know, because we don't want anyone with a fever coming to school or going to work. But just because you don't have a fever doesn't mean you don't have COVID. So some, just in the past few months working with childcare providers, there have been situations where staff or family were like, well, I didn't have a fever, or my kid didn't have a fever. They had like a little bit of a cough, but we figured because they didn't have the fever, they didn't have COVID, but that's not the case. So just one thing to keep in mind. So it's a measure to kind of help reduce the possibility of someone with COVID coming in, but it's important to think about the other symptoms too. So if you or your child, so if you're a staff member, or if you're a parent, if your child has a cough or a runny, stuffy nose, or hopefully not, but shortness of breath, or there are also other symptoms like diarrhea, you should not send them to school, or you should not come into school. But the temperature check is one way. I think the other thing about the temperature check, again, it's kind of something that you do. It's like a reminder that every day, yes, I'm supposed to think about my symptoms. And sometimes we need to actually have to do something to be reminded of thinking about things. So I think it's another good, like, okay, well, now I have to go take my kid's temperature. Let me think about the other symptoms of COVID. Let me think about whether it's the right thing to do to send my kid to school that day.
Yeah, no, thank you for that. And I think sticking with that, one of the questions also parents submitted was the kids that don't show symptoms, right? So if they don't have any symptoms and they're coming into school, right? Like what they're worried about that. So can you talk a little bit about that and how we're seeing that in other schools, how they're handling that?
Yeah, so the one interesting and good thing about COVID for kids is that they have had milder symptoms. They generally have not severe disease, and many children are symptom-free. So this is where it's really important that everyone is wearing those masks, whether you're a child or an adult, because we know that people are asymptomatic and they have the infection and they could spread it. And so, again, really important that everyone's wearing a mask. This is why, regardless of whether anyone looks sick or not, everyone's wearing a mask and they're socially distancing. So important, and doing that hand hygiene. At this point, as has been the case really throughout the pandemic, you kind of have to think that maybe anyone around you could have COVID, or that you could potentially have COVID. You never know. That's why all those preventive things are so important. That being said, we have some data that in addition to having milder symptoms, children under the age of 10 might not spread it. Like the younger kids might not actually be as good at spreading the virus. But regardless, we still want everyone to wear the masks. And so for CPS, it's not like daycares with kids under the age of 2 who can't mask. Everyone is old enough to be able to wear that mask. So that's very important. But it's also, this is another good time to remind everyone, I think, sometimes people forget they get exposed, and they forget that the kid should be quarantining. So if your kid has been exposed, or you have been exposed to someone with COVID-19, that's another reason why you need to be staying at home, because you could have COVID and not realize it because you don't have symptoms.
Absolutely. No, thank you for that. And it's again, a great reminder why we need to wear those masks every day, even if we don't think we're sick or we don't think the other person's sick, we need to wear them and keep our distance from each other.
Yeah.
So thank you for that. One of the other questions we got from parents was for our cluster students, for our special education, we have a couple, several groups that are nonverbal, right? So the fear of the parents would be sending them back to school. And if they do get sick, they're not able to express that they're not feeling well. So how does the medical field, I guess, has been dealing with that, and especially with those kids that are nonverbal?
Yeah, it can always be challenging. That's where, taking the temperature is important too. But I think for many parents, so you know your child best. And so in speaking with some and taking care of some nonverbal patients, the parents are always able to say, he just doesn't look right. Or he's sleeping a little more than usual, or not really wanting to eat. So those are the same signs that you would use to determine whether your child was sick with something else, whether it's a regular cold or the flu or a stomach bug. It would apply here too. So just using your parent spidey senses and just knowing when something seems off. And if your child doesn't seem like your usual kid, talk to your healthcare provider, because then they can bring them into clinic or take a listen to their lungs, things like that. But again, just being very vigilant and realizing that you do know your child best, and that if anything seems off, make sure to talk to your healthcare provider. Again, take the temperature, and there are some other signs, like if you're seeing more mucus or like they seem a little more gunky or clearing their throat, it's another sign that maybe there's some more mucus going on up there and that you should probably talk to your healthcare provider. But again, I would say you would use the same parent skills and like your good sense and your intuition and knowing your child the best to pick out when your child doesn't seem right. And if your child doesn't seem right, talk to your healthcare provider.
Yeah, no, those are absolutely good tips to keep an eye on, especially those kids that are nonverbal, to make sure that they're acting the way we know them to, right? And then if they're not, to call the doctor. One of the other questions parents had, if they do decide to send their kids back to school, right? For those parents that are at the edge and right now they're like, maybe I'll send them. What else can they do to protect their kids? Is there anything else that we're missing that we can give them some guidance? What else can they do to protect their kids if they're sending them to school?
Yeah, so I think just working, because they're going to get this education and reminder at school too, but when they're not in school, reminding your kids to wear the mask, reminding about distancing, so that it just becomes ingrained. And it's likely that you're already doing that. So when they go to school, it'll be like nothing. I was actually so surprised that, I have a 4-year-old, just turned 5, so he's going to be a CPS kid come the fall. But I was so surprised that he was able to keep his mask on. First of all, teachers do amazing things in school, but he kind of has learned, like he kind of steps away from people for going on a walk. He knows to keep that distance. So I would recommend just reinforcing. It's kind of like, like they tell me, like, make sure you're reading, or today we learned to write the letter B, like make him like practice his B's at home. I think it's the same thing here. Try to, what you would want your kid and other kids to be doing at school, just reinforce that. And then just talk to them about the whole situation. I think this is getting more to kind of like the emotional and mental health. It can be a little bit strange. School is going to look different, especially if you have an older kid. I'm just kind of checking in with them and reminding them. So, like my kid's always like, when are we, because he loves the science museum and it's closed with everything. He's like, when are we going? And so now he's like learned to just be like, oh yeah, coronavirus, like, but we'll be out of there soon. So just kind of checking in with your kid. Everything is coronavirus. Or if he doesn't want to like do something, I can't, coronavirus. But checking in with your kids, talking to them how they're feeling about the whole situation, in addition to reminding them about all the preventive measures, I think is so important. Hand hygiene, very important too, especially with flu season.
Yes, absolutely. Absolutely. One of the other things that we wanted to ask you a little bit about, it's about the city's tracing for all the COVID and what's happening. Like, is that helping us? Is that something that parents need to keep an eye on to figure out like where we are as a city, if now that they're making this decision? Can you talk a little bit about that?
Yeah, so we've been working really hard to really build up our contact tracing system. It's a tried and true method. It's been around for decades. I don't know, maybe centuries. I don't know. Basically, until we get the vaccine, until everyone's protected, to let people know that they need to go into quarantine. But it's not just notifying people and telling them to go into quarantine. It's also going through all the public health information, going through health information, and then seeing if there are resources that anyone may need because they're suddenly having to stay at home. I think one thing to know is that we are actually building up a specific protocol and system just for CPS families and staff. So if there were a positive person in anyone's pod, like action, like we have like a set of steps that are going to happen. Again, especially kind of set aside for CPS with our contact tracers. And so if you so the school will let you know if your child or you've been exposed, but then a contact tracer will also reach out to you to give you some additional support. So if you get a call, make sure to pick up and just to also check in, because we want to, and I know CPS will already, and they already do work with many families and staff members in the way of resources, but we also want to give you additional resources that the city may be able to provide. So the contact tracing piece is important. You may have seen that it's been a little challenging with the surge of cases trying to keep up with everything. But like I said, for CPS, we have a very specific protocol. And so essentially prioritizing CPS students and staff, because we feel this is so important to help everyone get back to school safely. But if anyone, even just if your friend calls you and says, hey, I have COVID, I've exposed you, please just go into quarantine. You don't have to wait for the call from a contact tracer to do that.
Awesome. No, thank you. And that's good to know. And I think, I mean, as a parent of CPS, knowing that there's a specific plan, right, for like my kid's school and like the district, that's really helpful to know that it's not just the city, right? It's now specific to CPS. I think that's very helpful. I saw in a question in the chat. I know when you were talking about other districts and other schools doing it, one of the questions was the similarity with demographics with our students in CPS and other schools. So is it similar? Can we truly compare like other district or other schools with CPS schools?
Yeah, actually, I don't have the exact numbers, but we've been looking to the archdiocese system as kind of a model and a school system to watch. I didn't know this until recently, but they are apparently the largest urban, maybe private school system in the nation. And so in looking at their demographics, it actually mirrored Chicago's pretty well, which I didn't realize. That's good to know. So basically their student body is mirroring what the city of Chicago looks like. So, I mean, that's an excellent point. And certainly there are some schools that look very different from CPS. And that's another reason why, you know, we're letting each school and each school district tailor when they come back to school, how they come back to school, because each district looks so different, each system looks different, and you have to do what's right for your school's families and your school's community. But the archdiocese, it was really interesting to me when we looked at the demographics, and they had surveyed their students, and out of those who responded, it actually fell out, like it looked exactly generally like how Chicago looks in terms of our, and I'm talking about racial, ethnic demographics.
Sure, no, and I think that's helpful, right? Because we see our students, and obviously because we don't know other school districts, we're just like a little worried about what that looks like and if it compares to us. So I appreciate you bringing that up and that comparison, that they're very similar, especially here in Chicago. And I think now, I don't know, Adrian, if you want to touch on any points, or if we want to open it. I know there's some parents on the line. I don't know if they had other questions for Dr. So. So at this time, either put them on the chat, or where you can unmute yourself as well, or raise your hand, and we'll let you have a question. Let's see, I'm going to check the chat and see if anybody has put anything else.
Sorry, can you guys hear me?
Yes.
Okay, there's one question in the chat. It says, do those other schools you're speaking of have similar demographics to CPS?
Yeah, we just answered that, Sarah. Thank you. I appreciate it. So I guess the other question would be, as parents are gathering their thoughts with all this information, because I know it's a lot of information, right? Even for us, for me as a parent, that trying to make the decision, trying to figure out like, are other kids going to wear their masks or they're going to wash their hands? It's just a lot to process. So as we're thinking about potentially sending our kids back or not sending their kids back, what are some tips, I guess, Dr. So that you can give families when they're starting to think like what should be like the first thing, I guess, when they're making this decision? Like, should they be thinking about them and what they're doing, or should they be worrying about other families, right? Because I hear that from a lot of parents, like, I know what I'm doing, but I don't know what other families are doing. So I think that's also part of that hesitation to send kids back to school. So how do we deal with that anxiety of like, we know what we're doing, but we might not know what other parents are doing?
Yeah, no, and it's a common concern, and it's been just again using childcare providers as an example. Just we've gotten that question so many times. Like, we can control what happens inside of our facility, but how do we control what's happening outside and making sure everyone else is doing the right thing? I think this is where it's that, for sure, if you have a group of other families that you are in communication with, like everyone just getting on the same page and on board with doing the right thing, minimizing unnecessary contact with others if you are going to send your kid to school. And really we can only control what we can control. So I think it's so important, and I'm sure everyone here today would make sure that you don't send your kids if they're sick to school, really reinforcing the masking and all of that good stuff. So the advice we give to childcare providers is you can only control what you can control, but spread the word, get that message out there, get everyone on board to do the right thing. I want my kid to go to school. And so let's everyone do the right thing so that our families can take advantage of this in-person learning. But in the background, thinking about what can we do ourselves, and then being reassured that all of these, it's called mitigation measures because, it's layered mitigation, meaning there are multiple layers. So if one thing fails, or someone doesn't do the right thing, there are other checks to prevent someone from getting COVID. So let's say there's a family who decides that they want to gather with others, they get exposed, and their kid comes to school. You have other checks to prevent your child from getting COVID that are going to be in place. So that physical distancing, your child isn't probably going to get so close to another kid. Your kid's going to wear a mask, and at school, the teachers are going to make sure that other kid is wearing a mask too, and they're going to make sure everyone's washing their hands. And so again, those layers of different things, and then you're going to have the good ventilation and the filters and whatnot. So it's all the layers that are going to help, even if someone happens to come in with COVID, to prevent transmission from happening. But it's a big decision. I was considered kind of like an emergency worker. I had to keep working when we all went to stay at home. And I had a brief luxury of my dad coming. He drove up from Tennessee, and we were like, don't come, you're old. But he came and he helped take care of our kids. But when the stay-at-home order was extended even further, he was like, I need to go home. And so we were like, oh my God, my kids are going to leave home and go to daycare. And I was scared. Even being in public health, knowing in my head, like, it's going to be fine, it's going to be safe. And so the first week or so, I was really hesitant, and I was like, oh my gosh, I don't know what that kid and that family is doing, but it all worked out well. So have there been cases of COVID at my daycare? Yes, there have been a couple of times, but neither of my kids have gotten COVID because they quickly sent whoever needed to go home, and my older kid is masking and all that stuff. So I become a real believer of the layer, what we call layered mitigation, or the different layers of prevention. It really has been, it's been working. And so, yeah. And then I just try to not think about what others are doing.
Right.
Like, when I talk to my brother or like other people, I'm like, hey, everyone just stay at home for right now. Distance if you have to see other people. Let's get everyone back to school, everyone back in the community again.
For sure. No, for sure. No, thank you for that. And I think it's as you were saying, I was like, that's right. Like, there's different layers that they're going to have to go through, like this little, like you were saying, those droplets, right? Like staying away from each other, wearing those masks. So that's helpful to know. We did get another question here in the chat. And so one of them talks about, we have been informed that staying close to each other indoors for more than 15 minutes, right, brings up the risk of contacting COVID. So she wants to know a little bit about that since the kids are going to be in, and then what type of ventilation are we talking about CPS? So that might be an Adrian question, but talking about the 15 minutes locked in together. Can you talk a little bit about that, Dr. So?
Yeah, so the 15 minutes you're probably getting from the definition of a close contact. So it's not only 15 minutes or more, but it's also being within that 6 feet. So again, like we're talking about the different layers of prevention, the students, as much as possible, and staff too, are going to be distanced when they're at school. So that's going to prevent that transmission from happening. The more you're indoors, yes, the bigger risk of potentially getting COVID is because you're not having, like, the droplets can't disperse in the air like they can outdoors. But just think about other places where we know there are lots of people indoors, like hospitals or like my office building. We're all inside and we've been working at the Department of Public Health throughout the pandemic. And people aren't randomly getting COVID because, again, we know how that happens. So it's not just the amount of time people are inside, it's also how close are you to other people when you're inside. And we know, again, that at schools, there are those protocols where people are distanced, and every workplace should have it too. And so important to keep in mind. And then again, the good ventilation is going to help. Really, you just want good air movement. And the other thing to keep in mind is COVID isn't like what we are airborne, truly airborne infections. It's not like measles. It's not like tuberculosis. If that were the case, we would have seen far more cases of COVID in this country and in the world. So it's not those little droplets that are randomly there. You really do need to have that close contact to get COVID.
Got it. No, I think that's helpful. Adrian, can you talk a little bit about that ventilation and the HEPA air purifiers, that kind of thing?
Yeah, so I think one thing that is really worth, for those of you that have been able to join prior board meetings when we talk about reopening, I really encourage you to visit. If you're not able to join live, those CPS board meetings have really good information around reopening and the frameworks, and you're able to hear from subject matter experts that are way smarter than I am, and are literally they're subject matter experts. This is what they do to keep our school building safe. We put them on our YouTube channel shortly. Well, one, we stream them live, but then two, they're uploaded for later review. And so I can make sure that our FACE managers share those links with our families. But we did an audit of all schools to ensure every classroom is properly ventilated and inspected by an independent industrial hygienist. Any classroom that does not have proper ventilation, meaning fresh air coming in and an exhaust that's aligned with national best practices to increase that airflow to mitigate the spread of COVID-19 will be addressed or closed until repairs are completed. And so that's kind of, to Dr. So's point around mitigation, it's an additional step that we've taken to help mitigate the risk and the spread of COVID-19 in our buildings.
Yeah, and just to add to what you're saying, Adrian, I think for parents, if you do go to the CPS website, CPS put up the list of schools, and then you guys can see by room number and that stuff, because I did that for my son's school right away. I went to check. So you can check the school when it was inspected, the rooms that were clear, the rooms that weren't. So for peace of mind, you can go to the CPS website and see that as well. We have another question in the chat. Let me see. So does the cleanliness of the school play a role here? Has CPS not had a great history in that area? So does the cleanliness of the school play a role now during COVID-19?
Yeah, so, again, the primary mode of transmission of COVID, we know, is through those respiratory droplets. We really don't think that transmission through touch, so touching something is really a significant way that people get COVID, but we still want to prevent that from happening if possible, and definitely during flu season. So the important thing is that like high touch surfaces are frequently disinfected. So in learning about COVID, I learned about all different terminology, and our colleagues over at the folks who kind of do the cleaning and like facilities management for the city, they're always like cleaning versus disinfection. So cleaning is like if there's dirt somewhere or dust, you're going to clean it off. Disinfection is getting rid of the virus. And I know that CPS has come up with really increased protocols around doing the appropriate CDC guided disinfection. So disinfection is important, and it's going to be done. And again, CPS, and I think it was shared too earlier on, that there's going to be more than what you've seen in the past, and that's appropriate because CDC recommends it. So making sure those high-touch surfaces are being disinfected. High-touch surfaces, things like doorknobs that a lot of people are touching at the same time. So yes, I mean, we want to make sure that facilities are being appropriately disinfected following the CDC guidelines. What is in our control is that hand hygiene though. So that's when, because of COVID, now I touch a doorknob and I think about COVID, but then I know, hey, I have control here. I can go and I clean my hands or I disinfect my hands. And I know there's going to be increased access to hand hygiene, whether it's disinfection or hand sanitizer or washing your hands at a sink. So it plays a role. We know that, again, not to be a broken record here, but the masking, the distancing, that's the really important stuff. And yes, just let's be extra safe and extra cautious, make sure that there's no other way COVID can get in. And so let's clean off the surfaces, but also let's make sure we're washing or sanitizing our hands and cleaning our hands often.
For sure. No, those are great tips. Adrian, do you want to talk a little bit about what CPS is doing?
Yeah, I think a couple of things that are worth referencing here. One, we've made commitments to hire additional custodians to ensure comprehensive cleaning protocols are completed daily. We've invested over $3.5 million in sanitizers and soaps to be distributed across the district. The district allocated over $2 million to purchase 86,000 containers of EPA-approved disinfectant wipes. Schools are equipped with hospital-grade disinfectant sprayers, and sneeze guards and signage have been installed across the school. So I think a lot of what Dr. So referenced in terms of pieces to put in place to mitigate the risk have been put in place, and the investments have been made. And many teams have been at work day and night to make sure that our schools, when we do reopen, that we're 100% ready to bring on students.
Yeah, no, thank you for that. I think it's important for families to know what we at the CPS side are doing and keeping in mind, all these things that Dr. So is sharing with us, right? That it's important and that we're putting that as top priority for us. So thank you, and thank you, Dr. So for that. We don't have a lot of time, so I kind of want to refresh some of the stuff that we talked about, right? I know Adrian talked about reopening of schools, and he talked about the hybrid mode, right? It's the pod mode that we talked about back in September and August when we were trying to reopen schools in the fall. So keeping that in mind. The other thing to keep in mind, as Adrian mentioned, right, is if you do opt in right now, you have the option to opt out, right, if you don't feel comfortable. So that's something that is within your power, that you can change your mind. If you want to say yes today and then tomorrow or a week from now you change your mind, you're able to take your child and do remote learning at home. So that's always going to be an option for you as a parent thinking about coming in into the school now. Also, obviously, Dr. So said, right, like wearing our masks, social distancing. She talked about all the protocols that we're going to have in place. The difference, in the ventilation. Why is it different to be at a restaurant than in a school setting? So hopefully all those things giving you guys that are with us today a little bit more of information as you are making your decision to send your kid back to school or not. I know I have to make that decision too. So this was very helpful to get a lot of this information as to if I'm sending him in or not. As Adrian mentioned, we have until Monday, right, December 7th to opt in or out. So many of you hopefully received that text message or that email. So click on that link and send it in. I know we're making calls and your schools are also calling you to make sure that you guys complete that information so we know how many kiddos are coming back or how many are staying back, and the planning could get started. So I don't see any more questions. I don't know if there's any other parent that has one last minute question that they want to ask. I'm not getting any takers. So, Adrian, I don't know if you want to close us out.
Frankly, I just want to, I'd rather have Dr. So close us out, and any last pieces of advice as parents are weighing this decision. I'm with you. My daughter's in daycare. She's been in daycare since early September. I can attest that she is much happier being around other kids and socializing. And you're right, spot on. We I thought the hardest thing for her to learn, just because she's very she moves around a lot. I thought it was going to be difficult for her to adjust to wearing a mask. And I've been fascinated. Like she holds me accountable now whenever we go out to make sure I grab a mask. And so, any parting words from your end, pieces of advice as folks, continue to weigh not only this decision, but other daily decisions that we make in our day to day.
Yeah, no, absolutely. It's been hard these past few months. So I know what a hard decision this is for many of you. And so just wanted to highlight that, not minimizing all of the thought that I'm sure you're putting into it. And I think at the end of the day, it's kind of more of a, from human being to human being, you are going to make the right decision. So you're going to make the decision that's right for your family and for your child. And we're going to get through this pandemic. There's already a little bit of a light at the end of the tunnel, thinking about the vaccine, how we responded to the second surge. We're doing it. It's hard and we're all tired. But I think just be reassured that you know what's best for your family. We're trying to give you the information that you need to make that decision for your own family. So you're going to make the right decision, no matter what it is. There are a lot of different factors coming into play. Whether it's your child's health, your own health, your family's health, how well your child learns at home versus needing other kids to interact with. So just wanted to, say, we can do it. We're all in this together. We are a really great city. Thanks to families like all of you. Again, you're going to make the right decision for your family at the end of the day. We are always here to support you. If you have questions, I should probably say you can always email us at coronavirus@chicago.gov. So that's coronavirus@chicago.gov. This is for the public. You can ask us whatever question you want, COVID related, because if it's not COVID related, I don't actually know where those emails go. And oftentimes it's my team or even me who's seeing emails related to schools. So please, if you have any questions, reach out to us. You can also go to our website, chicago.gov/coronavirus. It's a lot of information, but if you take some time to pick through, I actually go on the website to learn myself. So please reach out to us. We're here to help you. And just thank you for all that you're doing to keep your family safe and to keep Chicago safe.
Oh, thank you for that, Dr. So, and thank you for taking some time today and giving us your expertise and answering Paris' questions. Adrian, thank you so much for coming in and joining us. Parents, thank you so much for coming in. I know it's a Friday night, but you chose to come in and learn. So I really, really appreciate you. From CPS, we thank you for everything that you've been doing and the support that you're giving us with remote learning. We're really, my goodness, thank you so much for everything that you guys are doing. We really appreciate it. And thank you so much for joining us. Have a great night. Have a great weekend. Thank you so much, guys. Appreciate it.
Everyone.